Hi, I'm Frank Spidell, retired emergency physician and recovering hospital administrator, and welcome to The Doctor Is In. In this show, with the help of guests, we explore healthcare in the U.S. and its interface with society. Now, I am neither an infectious disease specialist, nor an epidemiologist, nor a public health official. For guidance and healthcare decisions, I recommend you consult your primary physician, your state and local health departments, and the CDC. As I wrote today's script, we had lost over 974,000 Americans to the COVID pandemic. But we are seeing a gradual return to normalcy. Many states and the CDC are relaxing masking mandates and recommendations. Yet even as we experience a relaxing of directives, we are advised by the CDC's director, Dr. Rochelle Walensky, measures may need to return should things get worse in the future. Now, I think COVID-19 will return and will get worse in the future. I think that COVID-19 is a respiratory pathogen, and like other respiratory pathogens, it is seasonal. Beginning mid-October 2022, the number of cases and deaths will increase, and there will be peaks sometime in January of 2023, and decrease to a baseline sometime around mid-March 2023, the same as seasonal influenza. This is the world we are given. Sadly, much of the direction we receive is confusing, contradicting, and mutating faster than the virus. Sadly, this is the world we are making. Consider the CDC in September 2020. COVID-19 is spread by aerosol transmission, they told us. Then days later, they said it's not. And then days after that, they said it is. Confusing messaging reaches almost magical thinking. The aerosol transmission of respiratory pathogens has been long known and predates the arrival of COVID-19. See the BMC Infectious Disease article of 31 January 2019. And mirabile dictate. The CDC knew this too. Remember in 1994, the CDC, out of concern for multi-drug resistant tuberculosis and recognizing its aerosol transmission, issued recommendations that those providing care for those with tuberculosis should wear properly fitted N95 masks. They referenced NIOSH guidelines telling how to fit and test the fit of the N95 mask. So in 1994, the CDC recommended the use of only N95 masks because of the aerosol transmission. Only N95s were effective in presenting that aerosol transmission. Now consider the size of the tuberculous bacterium. It's 2,000 to 4,000 times 10 to the negative 9 meters. SARS-CoV virus, it's 50 to 140 times 10 to the 9th. Guess what? That's 1/40th of the size of the tuberculosis bacteria that they recommended we use an N95 mask because of its aerosol transmission. Adding to the frothing swirl of misinformation, we are deluged with the failure of lay press, including science reporters, to critically report on publications. I hear frequently, surgical masks are 40 to 60% as effective as the N95. That's based on a JAMA internal medicine report, which was based on 2 subjects, count them, 2 subjects, that were fitted with masks and were exposed to a sodium chloride aerosol for 3 minutes. That's not the real world. I began this talk with a quote from Dr. Anthony Fauci, head of the National Institute of Allergy and Infectious Diseases, emphatically dismissing on January 28, 2020, the asymptomatic transmission of COVID-19. Within months, the New England Journal opined that the failure to recognize the asymptomatic spread of this disease would lead to a public health policy failure, which we experienced. I also started this program with a quote from T.S. Eliot, The Second Coming. He observed, also, the best lack all conviction, while the worst are full of passion and intensity. During this pandemic, there has been no shortage of those with passion and intensity, ready to tell the country what to do, but never answering questions. Today's guest is Dr. Beth Ann Rosica. She's one of our best, and she has no shortage of convictions. She has campaigned, argued, and litigated to bring sense to our school policies during this pandemic. Dr. Rosica, welcome to the Doctor's Inn. And what did I get wrong?
Good morning, Frank. Thank you so much for having me on the show, and I'm thrilled to be here in person with you after doing 2 prior Zoom shows, so thank you. And I don't think you got anything wrong.
Where do we stand with schools getting open in Chester County?
Well, the good news is that schools are by and large open, and they've been mostly open for about the last couple of weeks. What people don't seem to understand is that up until probably the end of January, we were still seeing kids at home due to overly restrictive quarantine policies. So finally, the Chester County Health Department made a decision that they would no longer be doing contact tracing with the schools, and so therefore quarantine sort of mysteriously disappeared. So there were children who, if they came in close contact with somebody who had tested positive, even if they were not symptomatic, they were kept out of school for 5 days, and then previously it had been 10 days, and before that it had been 14 days. So we saw lots of kids missing lots of days of school that were perfectly healthy.
That quarantine policy always had me concerned. We were quarantining based on identified carriers, but we know that there is asymptomatic transmission, and we have known for a long time there was asymptomatic transmission of COVID-19. Were we testing every student every day before every class to see when somebody popped positive? No.
No. And what to me was even more ridiculous was that kids in close contact, you already have kids sitting at least 3 feet apart from each other. They're already wearing masks. They're already facing the same direction. So if all those mitigation factors actually worked, why in the world would it matter if one of those children tested positive and the kids in some surrounding area were then impacted by the contact tracing?
Just amazing. Where do we stand with masking in schools now?
Well, interestingly enough, the CDC waved its magic wand last Friday and said that it wasn't necessary for children to wear masks in school anymore. So now I believe that just about every school district in the state of Pennsylvania, with the exception of Philadelphia School District, has lifted the mask mandate for students, and it is now an optional choice. It's a parent's decision whether their child wears a mask at school or not.
The CDC ought not to be political, but isn't it amazing that this happened at the same time where there has been voices raised and horns by truckers sounded everywhere, where people are saying, what are you thinking? What are you doing? That this groundswell of discontent, reasonable discontent at foolish foppery enacted into public health regulation. Am I getting too off on the far corner of this, or is that the reflection of a public influence on public policy?
Well, I think that there are a number of factors that play into that. We probably wouldn't have time to discuss all of those theories today, but I do think that the timing of the CDC's announcement is circumspect. We've heard for weeks and weeks and weeks that changing guidance was coming, and it seems interesting to me that it was last Friday. There's been a lot of information released about communication between the National Teachers Union and the CDC and the White House around public policy regarding schools and masking. So I think that there's a lot more to drill down to look at who was really driving public health policy.
Yeah, who drives public health policy in our beautiful county, Chester County?
Yes, well, Chester County public health policy, I think, has been one of the worst across the state in terms of restrictions on children. What I always talk to people about is that the people who are at the least risk have the most restrictions. And this is what has been incredibly problematic as a parent and as an advocate for children in Chester County and really throughout the state. Although Chester County has been one of the most restrictive counties. Across the state, we saw mask mandates lifted in December after the Supreme Court declared that Secretary Beam's masking mandate was unconstitutional. So a lot of districts, a lot of counties across the state lifted those mandates immediately. Chester County, of course, did not, because we live in one of the most restrictive counties in the state.
One of the most frustrating things I have found is you can't get people who are making these decisions to talk and dialogue about the decisions they are making. You can't have a true, honest, explain this to me. Why are you saying this? What is the goal of quarantining students? Are we trying to contain the spread among children who aren't significantly, now realizing children do get sick and some children do die. Mm-hmm. That's true of influenza. That's yep. true of motor vehicles. I never got a sense that there was a willingness to have a real dialogue where you could have a give and take with questions.
Absolutely. I think that that's been, the lack of transparency has been what's been most concerning from my perspective. So the Chester County Health Department would say, we have no guidance. We're not providing guidance, which is true. If you look at their website, there was no guidance. But then the school districts would say, well, we're following what the Chester County Health Department is telling us to do. But they were having private phone conversations or conference calls about this so that information could not be subject to right to know requests, so that the public had no transparency. What I think this really boils down to is a fear of litigation. Our superintendent at the Westchester Area School District basically told several parents that he was more afraid of being sued for lifting the mask mandate than he was of being sued for forcing the mask mandate. So that was their risk analysis, apparently, that's how they were going to handle it.
Sort of a miniature of our society where the fear of litigation yes. drives decisions that have very specious basis.
Yes.
Because we don't want the pain of it being sued.
Right. Well, and what I find interesting is that there are several parents in Chester County who have filed petitions to have our school board members removed for voting to mask our children. So I was one of those parents. I filed a petition in the Westchester Area School District to have 5 of our school board members removed, who last August, prior to Allison Beam's order, they voted for a health and safety plan that required forced masking of all children. And we believe that that was illegal. We do not believe that school board members had the authority to authorize and force an emergency use authorization cloth mask on our children when in fact there was no state of emergency. So we did not argue science. We did not argue the efficacy of masks. We did not say whether they were good or bad. We simply asked a question of a judge: do they have the legal authority to impose this on our children? And there's a judge in Chester County now who is looking at 5 petitions for 5 different school districts out of 12 in Chester County to make that decision about whether those board members acted illegally or not.
In my misspent youth, I was a medical ethicist for a for-profit company, Tenet, and I will give them credit. Tenet is a for-profit company. And of all the organizations I've worked for, they were the most amazing in their attitude about litigation. The HIPAA laws are rather tangled. And we were at a retreat where their counsels, their legal department were going over with the ethicist how to handle things. Mm-hmm. And one thing was a HIPAA situation where you have an unresponsive patient who cannot give authorization, and a parent comes up tearful and said, "My child has been taken. Is my child?" And the answer that I gave was, absolutely. I would tell the parent, "Yes, I have got your child back here, and come on back." I was told by the council that was running this retreat, "You've just broken HIPAA," and I knew that. Mm-hmm. And I said, yeah. I said, you break everything, break every law, take care of the patient. Mm-hmm. And part of the patient is the patient's family. And it's a good law that's got some problems. And I'll never forget, she said to me, "You're saying the exact right thing. I will defend everyone in this organization who is doing the right thing."
Right.
That's what we have courts for. It's
Right.
not fun.
Right.
But if you do the right thing, that's better off than you doing the wrong thing and asking me to defend that.
Right.
That stuck with me.
Right.
And we've got to get that attitude.
Right. Well, and I think it's interesting because so many school boards have talked about the perception of masking. So parents come and talk and say, we want the choice, these don't work. And they say, well, maybe they don't work, but it makes people feel safer. And that's really, there are many people that believe that wearing a mask makes people feel more comfortable and feel safer.
Well, there's no harm to wearing a mask, is there?
Well, there actually are studies coming out now about the harm that is being caused around wearing masks. And again, I don't ever try to get into the science because nobody wants to listen to the science. Nobody wants the facts. Nobody wants the evidence. The other side, they're all fact-based and science-based. So it's not about that. It's about parents' rights to do what's right for their children. If you want your kid to wear 5 masks at home alone, that's your choice as a parent, and I'm not going to involve myself in that. But if I don't want my child to have to wear a mask, they shouldn't. And we kept pointing out, I took my kids on President's Day. We went to a trampoline park. Okay, inside there's hundreds of kids running around, jumping on equipment. Not a single one of them are masked. They're in each other's faces. They're falling all over each other. And they can do that. We can go to a restaurant, we can go to Costco, we can go to Giant. Nobody has to wear a mask. And yet the one place where they are forced to sit for 8 hours a day, they were required to wear a mask. It made no sense.
This is our world, and the reluctance to have a real dialogue about this hurts us. We're all entitled to our ideas. They can be bizarre ideas. Where it ends is where it hurts other people. And I think there has been huge developmental challenges. And also, we are creating people that are fearful and tearful.
Yes, yes. Well, and I think that's what's the most frightening. So the mask mandate was lifted for Westchester on Monday, and I asked my children, how many kids are wearing masks, how many aren't? And, in some instances, it's 50-50. There are still a lot of kids wearing masks, which again, that's their choice. But I wonder how much of that is just that they've become fearful, especially young children. They've become scared and worried that something is going to happen to them. We've seen, I just read an article I posted on my LinkedIn page about the delays in reading. We're seeing that 1 out of 3 children is not reading at the right grade level as a result of the last 2 years. And so much of that, I believe, is related to the mask wearing because children learn to read phonetically. And if you can't see your lips, the teacher's lips making the letters, then, it's harder to learn that way.
So this mandate in some ways is hurting people who are least threatened by the illness.
Yes, yes. Right. The children who are at the least risk have had the most restrictions. We have basically put on the shoulders of our children the burden to bear for every other person's health, safety, and anxiety. Right, exactly. Yes. So it's interesting. I was telling you before the show, I read a blog by Vinay Prasad, and he talked very specifically about it's time for public health to have some of its own medicine, that the restrictions that have been placed on individuals, we now need to look at placing some of those restrictions on public health and on private agencies. And he had a great piece here about, if there's another emergency situation where interventions are required, we need randomized control trials. They have to be done within 3 months to show that whatever these interventions are work, and if they don't work, then they need to be scrapped.
He's a great author. I've thoroughly enjoyed reading him, and I couldn't agree with him more. We need to rethink our approach in public health. Anecdotal observations has replaced the randomized control trial. And one of the challenges we both have in this time is I can find good peer-reviewed articles that say the sky is green. I can find articles defending and asserting anything. There is a myriad of them. We have to use our wits and sort out and figure out good reporting from bad reporting. Gottlieb's book, Outbreak, was wonderful in the sense that he reported something in there that I haven't been able to find documentation other than his book. Uncontrolled is the title of the book, not Outbreak. Uncontrolled. That early belief was that this was spread by droplet, not aerosol. And we had known before that it was an aerosol transmission of all the respiratory pathogens, including tuberculosis. Aerosol being suspended in the air indefinitely for hours, days, and that it's different than droplet transmission, where I cough or I sneeze, and you can see material going out from my nose or my mouth. When I'm breathing, you can't tell unless you hold the mirror up where the mirror is cold and my breath precipitates on it. So that's the aerosol transmission, what comes out of our lungs, and we've known that is how the respiratory pathogens get transmitted. At the start of the pandemic, some people were flying from Washington who were coughing, and because of that, this was in the first weeks, they cleared out the area around these people that were coughing. And they had like 2 rows behind them, and they were all by themselves coughing on this plane flight. And I respect trying to solve a problem. Much of what we do is we don't know what we're doing, but we do something that we think may help. They carefully followed all that other cohort, that little study group, and no one got COVID except for those 2 people that had been coughing. So the assumption was, well, this must be a droplet transmission. I'm coughing, and if I stay 6 feet away and keep some distance and some shields, I'm not going to get it, because we have this study, this accidental study.
Right.
Just one problem. When you build a hospital, and there's certain standards you have to make, because in a hospital, some bad things happen. We aerosolize infectious material. When we do bronchoscopies and we're working with somebody that's coughing up TB or coughing up all sorts of bad pathogens, it can be aerosolized. So we've known for a significant period of time that air exchanges in bronchoscopy suites, and in the ED and elsewhere, but in the ORs, prevent transmission of these respiratory pathogens. That if you're going to do bronchoscopy, the standard is you have to have 3 air exchanges per hour. 3 air exchanges, no transmission. When you fly on a commercial jet, you have, oh, it's incredible, it can't really be that. You have 20 to 30 air exchanges per hour through a HEPA filter? Gee, do you think that might have had something to do with it and it's not a droplet transmission? That failure is something we tried to teach people about in middle school science. Post hoc propter hoc, because something occurs temporally does not mean it's causally. Because we separated people, that did not mean definitively. And we have another common thing, 30 air exchanges per hour through a HEPA filter, maybe that prevents the spread. Oh, always talking to you is always wonderful. What do you see going forward? What's going to happen going forward with this?
Well,
are we learning?
Right. Part of what our concern is, the parents that I work with, is that the CDC will wave its magic wand again and we will be right back where we started. So that is part of why we pursued the legal question, because we don't want these school boards to have the ability to make these types of decisions on behalf of our children. People are looking at us saying that we're extremists, this is over, COVID is over, you need to let it go. And I think that what we've seen is that the overreach and taking away of parental rights to make the decisions about what's best for their children is not going to go away. And so if we don't stand up now and expose what has happened and determine what is legal and what's not legal, we are at risk for this to continue. Like you said, this is going to morph into the regular flu. Come next October, we're going to see cases go up. Everybody's going to freak out. They're going to talk about school closures. They're going to talk about masking. So we need to get in front of that now.
Dr. Rosica, I am always honored to spend time with you. I admire your courage and your fighting the good fight with wit and energy and facts. Rare nowadays. For those of you out there, thank you for watching The Doctor Is In. And then invite your prayers and your resolution and support for those people in Ukraine who are trying to preserve their freedom at the cost of their lives. We have great people in this world. Be safe out there, and thanks for watching The Doctor Is In.